techniques, then working into muscle energy techniques, then non-thrust techniques, and into address. Right? So for this technique, we're going to do it's a cult horn technique, and we're basically stabilizing cervical spine. Sorry, that table doesn't work, so I don't know if the lefts or rights are correct. But with this, I'm a little bit closer to this. This is nice because it's a soft tissue technique, and remember how Dr. Boyce had drew the facet joint angles as they're coming up towards the eyes when the patient is supine. So you should be able to visualize that orientation, that 45-degree orientation. So it's not here, more like this. Okay. So with this technique, we're going to go with the joint direction. Okay. So this soft tissue technique is soft tissue, but it's also with the joint. I'm right in front of the screen. Sorry, guys. There's a little line of curve going on here. Probably not bigger than anybody else's. Sorry. So I'm going to move it forward a little bit. Is that okay? Can you still look at that with the screen?
I think you're going to be more.
Let me get complete. Whatever. There we go. Okay. This is good. Can you see now? Okay. So I'm going to stabilize caudally. So by stabilizing caudally, he's stabilizing the shoulder. And I'm going to use my upper hand, my supplement hand, and I'm going to start at C7, C1, and I'm going to capture the soft tissue again, kind of hooking my index finger and third finger around the segment that I'm going to start at. And so I'm basically just going to pull, capture the tissue, and I'm going to go up in the direction that I'm moving. So up towards the eyes. I'm not going to do that, but I want to give you an idea of what I'm doing. So here. So I'm just capturing the tissue, not rubbing across it, not giving her a burn. Okay, that's really uncomfortable. You want to think of hooking on and just trying to splay the muscles and the skin and everything a little bit laterally. Okay, so that looks pretty good, doesn't it? And you can pick an area. All right. Now, if I were doing an up slide on this her left side, okay, that would create a little bit of rotation to the right, correct? So I could also kind of pre-position her if I wanted to do a little of functional mobilization, as Dr. Boyce likes to call it, in a little bit of side bending and rotation at those segments. So that's a nice technique to do. Another variation of this, well, actually, I'm not going to show that. Let's just practice this one, and I'll show you a variation.